The last section we're going to talk about in this chapter is a drug that helps you form and repair red blood cells. In the textbook, this discussion starts on page 276. They're known as erythropoiesis stimulating agents, and there is a table 14.3 that talks about these different drugs. The ATI book also has a whole chapter that includes this, and you need to know this for the ATI testing, which is coming up, hopefully, if we're at school. So make sure you read pages 193 and 198 to 198. It can only help you on this test and help you when it comes to the ATI test, both practice and proctored. So the prototype drug is a drug called epoetin alpha, and its trade names are Procrit and Epigen. These are synthetic erythropoietins, and so it's going to help people grow new red blood cells if their body is unable to produce blood cells at a quick enough rate because of some kind of existing disease. So this is going to cause, if you're not making red blood cells, you're going to have anemia. And we see this in cases of renal failure because the kidneys have an awful lot to do with making, producing red blood cells. And many times in chemotherapy, the red blood cells are rapidly killed, and so the person needs more. Also, HIV patients taking some of the medications for HIV, in particular AZT, which can kill red blood cells, benefit from these particular drugs. Procrit and Epigen are given either sub-Q in injections or IV, and the dosing is 1 to 3 times per week, depending on the patient's condition and situation. Sometimes they're just given in injections, and sometimes the person comes into maybe the infusion center if they're getting chemotherapy, and has a few treatments a week to keep those blood cells being produced. Now, producing red blood cells is a really good thing, but they can be produced too rapidly, and then you can end up with problems, particularly hypertension, as the blood gets too thick and too full of red blood cells. And this is a case where you see, blood can thicken. So whenever somebody is getting Procrit or Epigen, you want to always keep an eye on their blood pressure. You're going to get a baseline before treatment, and you're going to periodically check the blood pressure during treatment. Then you'll draw a CBC with differential, where they're looking at all different types of red blood cells, or all sorts of types that are found in that sample of blood. They're going to be looking at their platelets. They're going to be looking at a serum iron count and different tests for fluid and electrolyte balance, because we don't want so many cells that the fluid carrying it is kind of off kilter. So as the nurse, you need to know that the biggest problem that could be caused is extreme hypertension. So you're looking for headache, nausea, other cardiovascular events, and autoimmune-related anemia, as the immune system turns on its own blood cells because it's like, what is this? Why are we making more blood cells? We need to get rid of them. Procrit is going to make the blood more viscous. Viscous means thick and sticky. Do not confuse this with vicious. They're similar, but it always amuses me when I'm reading, some nurse or medical specialist on these online blogs, and they say, his blood grew very vicious. No, it didn't. It got thick and sticky. Blood is pretty laid back ordinarily. But here you're going to see a thickening of the blood. Common side effect is pain at the injection site. So you see that a lot. That's normal. You're going to tell this person, this is going to sting a little. It's not too bad. So for your nursing interventions, you're going to check the BP very regularly. You don't want to shake the solution like protein-based solutions. Those little proteins can be broken. You're just going to roll it between your hands, especially if it comes out of the refrigerator. Pretend it's a roll of cloudy insulin and just gently roll it between the palms of your hands. We always discard the remainder after using. There are no preservatives used in erythropoietin, whether it's for sub-Q or IV. It's not preserved, so it's going to stay good as long as it's sealed and in a refrigerator, but once it's opened, it's not going to last very long, so discard it. You're going to want to watch for seizures in these patients. The rapid increase in hematocrit, and this drug works really well. It makes these red blood cells at a fairly rapid clip, but as the hematocrit goes up, you're going to risk hypertensive complications, and one of these is encephalopathy. The blood pressure goes really high, the brain swells, it's unable to cope with all these new red blood cells, and so there is swelling of the brain and inflammation. So you're going to look for any change in mental status and possible seizures. And that is it for this chapter.